crisis hit, and we were in February or March. I already knew we were closing, and we were closing for a long time. I have family in Europe. To me, it was very surprising that many of our colleagues coming March, even April, were still thinking that they were going to reopen in 2 weeks, reopen in 3 weeks. I was like, guys, we're going to be closing until the summer for sure. No, you're crazy. The economy will. No, we are. I remember my last photography course was in Miami on March 14. And I remember that I knew March 14, I had closed my clinic that was a Saturday. I was going to close it that Monday. And more than half of my audience in that photography course, it was like 40 colleagues, were saying that I was crazy, that we were not going to close, that this was just a little, and I was like, guys, what are you talking about? I even remember doing a little speech at the end in which it was kind of like a sad closing to the course, saying, I hope we don't regret meeting here. I hope that this meeting is not a mistake, that we should all stay home. So I always knew that this was serious. How serious? I had the same problem that you all guys had, but I never took it lightly whatsoever. And very, very early on, I think I closed the office on March 15, even though everybody closed like the 26th and some of them even a week after, here in Massachusetts at least. I always knew that it was going to be closed for a while, and that coming back wasn't going to be the same. That was pretty clear.
How did you get there though? How did that happen? How did you?
Because it wasn't too hard to look at Europe. It wasn't too hard to see what was happening 3 weeks ahead of us. At that point, Italy was inflamed, Spain was inflamed, right. and we're like, what, are we different? It's pretty clear. You get to see what's happening, and then it's always been a classic virus aerobic infection.
Right. So
the argument of, is it in the air, is it not in the air, should we wear a mask, should we not wear a mask? I remember flying to the Chicago midwinter from Boston in late February, already wearing a mask. I was the only one in the plane wearing a mask and cleaning everything around. I'm not saying, oh, look at me, I made a million mistakes in my life. But this was a surprise because to me it was pretty clear that being proactive has no harm. And we're still arguing about the mask today, which means so I knew that coming back was going to be an issue, and that the issue was going to be know how to clean the surfaces, know how to change yourself, know how to do anything else. The issue was going to be, how do we clean the air? That was always clear for me. And that is when I made the decision very late March, early April, with a friend of mine, Dr. Jason Tubo here in Massachusetts, that we were not going to go and buy this little to do anything, that we needed to clear the air. So we did some research and we realized, okay, a negative pressure room seems like the way to go. I have 4 operatories. He had 11 or 12 or something like that. So negative pressure room basically is like having a kitchen hood inside your operatory. The whole air gets sucked up through a vent in the ceiling, completely silent. You sucked all the air, you filter, you recycle. Then it became, okay, does it mean that I have to have a sealed room? No, it doesn't mean that you have to have a sealed room. You should have to have some kind of curtain or something, so that even if there's a space around, just like a curtain from the window, you create enough of a closure that air can just flow in. So you create a unidirectional flow of air into the operatory, meaning you're treating a patient here, you're creating aerosols. Those aerosols don't go out. The air is always coming in. This is classic in hospital ER rooms. The other thing that didn't sit well with me was just having a HEPA filter. I said, like, a HEPA filter alone is not going to do it. And I also wanted my rooms to be independent. So we called the engineers and we said, we wanted to have a negative pressure room. We want the air to be filtered with the thickest, if you want to call it, HEPA filter, which is what we have on the air conditioners. But I want more. I said, like, I know you can scrub it. I know you can electrify it, ionize it, whatever you want to call it. I said, yes, we can add that. So then the air gets sucked up. It goes through the filter. This is on a HVAC system in the roof. After that filter, it goes to an ionization stage where the particles get electrically charged, and then you can scrub them by poles. And then at the end, I told the engineers, I say, I want a UV light. They're like, where do you want a UV light? Like, I want a UV light in the system. They're like, that's impossible. I'm like, why not? The air is going through. Make it go through a UV light. Like, that's the simplest thing ever. And they actually did some research, and actually I didn't invent that. It existed already. So we did that. So then we did the math. Okay, I have 4 rooms. How long will it take? You know, we had to, you know, open the ceiling, put all these things. And this was late March. By the first week of April, I already had it. It was done. And I reopened in June. Anybody who wants to see this system, and I'm, you know, it's not an advertisement because you're colleagues, you're not going to come for me to fix your mouth, but it's in my website for the clinic, litdental.com. There is a video there. Yep. It was eye-opening when I tested it. Now, we tested it with a smoke machine. So we brought a party smoke machine. We put it in the operatory and we make it puff, right? Get the operatory full of smoke and shows weight. And when you don't turn this system on, which you cannot hear it, the smoke just lingers. And then it starts coming out of the room and you see it going into the hallway and you go like, man, that's what we were doing all the time as we drill. Now we turn that system on and the air completely clears. So one of the things that we wanted to do was, the engineer said, okay, we can put this and, you know, you can cleanse the air a couple times a day. I'm like, I want it every 4 minutes. So what are you talking about? I want the whole air in every single room to cleanse every 4 minutes. And by that, you need to do the math of the square foot or the cubic feet and the air handling and whatever. And it actually came out that you can do it every 4 minutes. You can triple filter that air. And let's say you filter the air, it goes through the first filter, then it gets ionized and scrubbed, then it gets UV light, then it gets dumped outside and comes right back in. Let's say you have a virus in the air that the first time around wasn't scrubbed, well, you're gonna have to go through it again after 4 minutes. So we, obviously, when we're just closed in April and we think, are we even gonna financially survive this debacle? I felt like the investment was not gonna be the one that break me. Like either we all go down in flames financially, right, or we just, you know, double down on this. And it was the best decision I ever made in my life, I think, because coming back, I had the chance to go to my old office to do a couple cases that I needed to remind. I see other friends. And the chaos that I'm seeing in many offices, the hygienists don't want it to come back, the assistant not feeling good, all these big machines making noise, suction and everything. My office is working almost, it looks normal. You don't understand. If you're a patient, you come in, the only difference that you see is that I'm wearing an overall now that I changed in between patients, which before you didn't have that. My mask, my goggles, and you're done. And everything looks like normal. The only difference now we have this little curtain that closes the entrance to the operatory. Patients kind of like it. Gives you privacy.
You know.
And it gave the team and the patients just a peace of mind that I've never seen before. Like, it was the best thing I ever done. And when I saw that video of the air getting clean and the mist staying in if you don't turn it on, I was like, we were working like this before? Ew. Like, it's one of the, I think it's one of those things of like, they used to work without gloves and now it's unthinkable. I think this is also like, if we don't purify the air forever, we're going to feel like, you know, all that mist that hits your face. How many times you like, you know, remove your glasses or something, you forgot and you can feel the things in your face and you're like, oh, well, that's there, you know, regardless of COVID.
What totally blew me away is the fact that it's not just negative pressure room. You have the filtration, you have the UV, and then you then within 4 minutes. So it sounds like it's about cycling the air through the room multiple times in a period of time, and every 4 minutes or so. So the potential for anything coming through is virtually nothing. I bet you your allergies are fantastic. That's it. I have allergies. I'm just going to hang out in your operatory.
It should be. One of the assistants mentioned that. She says, since we came back, my allergies been completely clear. And the good thing is they have 4 operatories. Each of them is independent with this system. They all have negative pressure airflow, so the air is always flowing from, let's say, the hallway or the waiting area or whatever you want to call it, into the operatories. And so in a way, as you're cleansing that room every 4 minutes, you're also cleansing the clinic, because I don't know what exactly the math is, but probably the entire clinic is filtered every 20 minutes or every 30 minutes. even the ones that are not actively a negative pressure room, because you have these 4 humongous air handlers that are doing this. So it was a great decision. It did not cost me an arm and a leg. I think we ended up spending about $8,000 to $9,000 per operatory. It's not, you know, this idea of, you know, you have to. It's a lot of money. I don't want to say, you know, it's a lot of money, but you know, it's not the end of the world. Or when you're prepping on the interior, those, you know, those little interproximal caries, sometimes you come from the front. I always have like the patient, the water is coming down the neck like this, and then you're trying to like clean them. It's not even with the Optrogate, it's not easy. Even with the rubber dam, if you're there, sometimes it's still like kind of go to the side. So, I'm excited.
So, but you use our system, yes?
I love removing amalgams with it. I'm not gonna lie to you. I love removing amalgams with the Isolite. Like, I am somebody that when I am prepping something, I don't 100% always use a rubber dam. I either use a rubber dam or the Isolite system. When it comes to restore, then I put it in. Many times, you know, I need to clean. I need to remove the amalgam, clean, prep, you know, have the patient like swallow and things like that. So I use the rubber dam to cement or to finish the restoration 100%. But when sometimes, you know, I love working on the upper first molar or lower first molar with the Isolite system. You know, it wraps behind it. And then this is it's not an advertisement, guys. Like I use it, whatever.